While talking about poop is something that makes kids, and most moms and dads, if we're honest, laugh and smile, when a child struggles with chronic constipation, it's a serious situation. Some researchers estimate that depending on the diagnostic criteria, up to 25 to 30% of kids struggle with constipation. The challenge is not just whether it's officially constipation or not, it's the fact that constipation is a sign or symptom of something more going on with the child's body. And that is why it's connected to so many other common childhood conditions such as autism, anxiety, sensory processing disorder, developmental delays, and ADHD. Chronic constipation greatly impacts a child's quality of life, causing all sorts of challenges with the immune system, their quality of sleep, energy levels, behavioral and emotional regulation, and so much more. If your child struggles with chronic constipation and you've tried every diet change, prune juice, probiotic, and magnesium supplement out there, and especially if you've tried Miralax for your child, then this video is for you. We'll break down the real root cause of chronic constipation that goes far beyond nutritional imbalances and gut health and get you drug-free options to help your child heal and greatly increase their quality of life. Please share with other moms and parents who you know need to hear this message. Maybe your child has a similar story to Lucas. Lucas had stomach issues going on since he was 4. He would either be doubled down over in pain, crying, or jumping up and down, sobbing in pain, weekly, if not daily. He would try to go to the bathroom with little to no relief. His mom said that they had gone to numerous doctors and specialists with no relief or explanation. He had x-rays and ultrasounds with no signs of anything wrong. And at 7 years of age, they were asked by a pediatric GI doctor to do a full GI flush with a bottle of Gatorade and an entire bottle of Miralax to help clean him out and help fix his problems. His parents said that that was a traumatic and unhelpful experience for the whole family. Mom said they felt completely frustrated, overwhelmed, and like there was no end in sight. But their hope was restored when they saw a post on social media similar to their story and had friends who also recommended pediatric chiropractic. Still a bit skeptical, they came to their first appointment, got scanned, and got some actual answers. Lucas's scans showed that his digestive system was extremely stressed and dysregulated. So when chiropractic helped calm and reconnect proper communication to his gut, Lucas saw some major changes. Mom says his stomach pains are way less and it is much easier for him to manage if they do occur. He's spending less time in agony and more time enjoying the things he loves. So how does that work? How does chiropractic help a kid go from barreled over in pain from constipation to thriving and doing the things he loves? It's by understanding this. It's not just genetic, and it's not solely a nutritional imbalance. It's a neurological imbalance. Many of our patients at Rising Health have already tried all the diet changes, probiotics, magnesium supplements, and so forth, and have seen little change in their child's constipation. That doesn't mean nutrition and these things aren't important and involved. It simply means that there is more going on. Clinically, we find that the vast majority of chronic constipation is actually neurogenic, meaning that it starts with dysregulation within the nervous system. There is too much stress and tension stuck on a child's nervous system, affecting the muscles of the digestive tract, which causes motility within the gut to be reduced, which leads to the chronic constipation setting in. Neurologically, this stuck state within the nervous system is referred to as subluxation and dysautonomia, which are two nerdy terms that mean the nervous system is stuck in fight or flight protective mode and it is out of balance. When the nervous system is in this protective and stressed out state, it greatly impacts the gut and digestive system. In a normal stress response, the stress hormone cortisol is released, which signals the body to shunt blood away from the internal and digestive organs and send it to the skeletal muscles. It's the body's way of conserving energy for the skeletal muscles to fight or flee. When this happens long term, the consequences of taking away that energy from the muscles of the digestive tract start to set in. This is when it's much easier for constipation to set in. This is also why we see chronic constipation in so many other neurological conditions as well, such as autism, ADHD, sensory challenges, anxiety, and so forth. They all stem from that same neurological imbalance and dysautonomia. So maybe you're at the point in this video where you're like, okay, I'm starting to see and understand the root cause of constipation a little better, how it stems from an imbalance within the nervous system. What can you do to help my child? Yes, let's cover that right now. Since constipation stems from a dysregulated nervous system, that is the place we go to first. Kids with constipation respond incredibly well to vagus nerve and parasympathetic stimulation through neurologically focused chiropractic adjustments. This is what we specialize in at our office at Rising Health Family Chiropractic, because the number one way to get a child's body out of that stuck fight or flight pattern is through an approach that addresses the nervous system. And neurologically focused chiropractic adjustments are the best way to do that. The focus of our adjustment is to stimulate and activate the parasympathetic nervous system and what's called the vagus nerve, which then in turn stimulates and activates digestive motility and relaxation. The running joke in our office is that this is where kids come to poop. It's because when a kid gets adjusted and is in an environment that is designed to relax their system, they let it rip. For little ones especially, it works almost immediately. They fill that diaper up quick, and if it's not in our office, it's usually on the way home afterwards or later on that day. We love what we get to do, helping parents get relief for their kids with changes that can happen so quickly and so naturally without drugs, an enema, or a suppository. To learn more about how chiropractic care could help get to the root cause of your child's chronic constipation and provide relief for your child, visit the link in our bio to learn more, comment below, or send us a DM. Be blessed, thanks for watching, and have a wonderful day.